how doctors make a diagnosis, and how we help our young patients stay healthy. Most importantly, this course will help you learn how doctors think about children and their medical problems. Though children are unique, many of these lessons apply to adults too. And of course, it's adults who usually bring our patients, the children, in for care. So whether you're a caretaker, a parent, or just an adult who's concerned about the health of kids, you will benefit from a better understanding of pediatric medicine. We're going to structure this course as a series of grand rounds teaching cases. You'll meet the patients, I'll give you the clues, and we'll figure out the diagnosis together. Now, don't worry, by the end of this course, I promise you'll get the hang of it, and I'll bet you'll get to at least some of the diagnoses before I do. To set the stage, I'd like to start with a patient you've heard of, a famous person whose story you already know. Her name was Helen, and she was born in Alabama in 1880. By her own reports, later collected into an autobiography, she was a healthy baby until the winter of 1882, when she developed a fever. In her own words, "In the dreary month of February came the illness which closed my eyes and ears and plunged me into the unconsciousness of a newborn baby. They called it acute congestion of the stomach and brain. The doctor thought I could not live. Early one morning, however, the fever left me as suddenly and mysteriously as it had come. There was great rejoicing in the family that morning, but no one, not even the doctor, knew that I should never see or hear." That quote is from Helen Keller's autobiography, The Story of My Life. Ms. Keller was born with sight and hearing until those abilities were robbed from her by a febrile illness, that is, an illness that included fever, at 19 months of age. How did fever make her so sick, leaving her blind and deaf? What would have happened to the same child with the same symptoms and the same illness today? Let's find out together. We're now back in modern times. Today, we're seeing pediatric patients in an emergency department. Our last patient of the shift is another 19-month-old Helen, modern Helen, and her mother brought her here because she's worried about her child's fever. Helen, we learn, had been feeling well until the middle of the night, about 12 hours ago. It's always the middle of the night when kids get sick. Every parent knows that. Mom heard her fussing in her room, and when she went to see her, she was crying and felt warm. Mom measured a temperature of 101.7 degrees. She gave Helen a dose of acetaminophen, that often goes by the brand name Tylenol, and after a little while, Helen fell back asleep. In the morning, that is this morning, she awoke again with a temperature, which again seemed to improve after acetaminophen. But she later threw up her breakfast, so Mom brought her in to see us. Helen has had no other symptoms, no cough, no runny nose, no diarrhea, just the fever and that one episode of vomiting. Mom says Helen has no important past medical history and her immunizations are up to date. She goes to a group daycare 3 days a week, though Mom says, as far as she knows, there hasn't been anyone sick there lately. We don't have a lot of history here. Helen had an elevated temperature of 101.7 and she threw up once, but that's enough to start with. Let's move on to our physical exam and see what clues we can find there. I like to start a pediatric physical exam with an overall impression of how children look. There's a good medical reason for that. A first gestalt look at a child often will tell you if they're sick or well. A well child acts his or her age. As an infant, smiling and interacting, or as a teenager, sometimes sullen or looking down. A well 2-year-old might act shy and scared to see you. The bottom line is that a well child is acting right, doing what you expect a child of that age to do. But a sick child, the way a pediatrician looks at it, a sick child acts sick. Not perky, not smiling, not interacting, just blah and flat and, well, sick. Even a sullen teenager will be interactive if you can engage them in conversation.